I'm Melody Heaps, the President Emeritus of TASC.
And I'm Pam Rodriguez, the President of TASC.
TASC is both an organization and a process that tries to link the criminal justice system with the substance abuse treatment system by intervening at every point along that justice system to try and get people out of the system and into treatment who are committing crimes because of their drug addiction. And so we begin perhaps at the court level where we work with felony judges. We also are involved in the prison system where we deal with people who are moving into the community, the reentry phase. And now, and Pam can talk about this, really moving toward the very early end of diversion and how do we stop people from even entering the system. It was one of the most special times in my life, and I was fortunate because history and my age came together, and I was able to work on issues with regard to urban poverty and connecting the issue of civil rights with urban poverty and the whole issue of social justice. And when Dr. King left Chicago, I was still working as a community organizer. And it was in 1968 when the heroin epidemic began on the west side of Chicago. And all these young people that I had been working with were literally gone, and they were in jail because they had started using drugs and became addicted to heroin. And at that point, I saw the connection between trying to do something about addiction and the connection to bringing social justice and confronting issues of poverty and race. And so that's how I began my involvement in the substance abuse world and the treatment system. Our interest in looking at addiction is what it does to a community and to an individual that institutionalizes their poverty, it institutionalizes their being on the lowest rung of the ladder. And until you can get them into treatment and moving in a healthy way, you're not going to be able to address issues of jobs, of economic security, of family matters, of education. And so we saw, and I see the interconnectedness. And I also saw that the criminal justice system and our ability as a country to offer justice was being compromised because of the many, many, many people that were entering the justice system who were addicted and the justice system wasn't able to handle it. And putting those people in prison only began a cycle of addiction, crime, release, addiction, crime, release. And so it was compromising, I thought, the very fabric of justice in our country. And so TASC seemed to be a logical answer to intervene in between both the addiction and the justice system and try and move people out of that justice system into treatment and into recovery.
The thing that we've seen since the 60s is that in many ways, the justice system has created, by criminalizing addiction, has created generations of folks involved in the justice system. And so what was sort of first generation users 40 years ago is now we're looking at the third generation of families and communities that have been affected by incarceration, have been affected by criminal histories, have been affected by years of addiction, and not surprisingly, probably then is not just concentrated in families, but also in communities. And so very often the same communities Melody's talking about that were affected by poverty in the 60s are now bear the additional stigma and consequences of years of criminal justice system involvement. And so if we're going to actually impact and prevent future generations of families and communities being impacted, we've got to find other ways besides treating the justice system as the primary place where people get treatment. They're going to need to get it in the community, and we're going to need to do things earlier in the process so that access to care happens sooner rather than later in the justice system. I think every point in the justice system is an opportunity to divert people, whether it's at the front end with law enforcement and creating opportunities for police to drop folks off and get assessments and treatment rather than respond by taking people to jails as if that was the only thing that was out there, through the court process where prosecutors are providing diversion opportunities for people based on assessments of risk and need, through drug courts as an alternative to incarceration. They impact the lives of many thousands of people annually. And if folks progress all the way through the system and you find them on reentry out of prisons and jails, we need to do stuff there. So I think there's no better point. The point is to do the best thing at each point that you can in order to divert people from the system. I'm really excited that Attorney General Holder has taken a public position with regard to the consequences of criminal justice involvement and criminal histories on the lives of the people that we serve. I think that kind of leadership is exactly what's needed to support the work that's happening in states and in communities all around the country. I hope that we can take advantage of this opportunity and of his leadership, and obviously then I think the President's commitment to making alternatives available to people and increasing access to care for people so that the justice system is the last place they go for care rather than the first place.
I think what's really interesting is no matter what side of the political divide you are on today, the states can no longer afford to spend the primary amount of their budget on corrections. It's too costly. It doesn't end up in any kind of rehabilitation, and it is just the cycle of arrest, addiction, and incarceration. So all the states are looking at a better way to handle this population. And I think that Attorney General Holder's position on this really supports that, and it can almost be a bipartisan kind of political issue, which is very good at this stage in the game. And it's now a national policy that says this is the way to go. We don't need to incarcerate addiction. We need to treat it. It is a public health. It is a public health issue.
My view is that if we're effective at increasing access to care earlier in people's addictions and earlier in their criminal behavior, we can shrink the justice system. And that would be my goal, that in 10 to 20 years, we would be looking at a justice system that frankly addresses what I believe we intended it to address, which are those people who are serious, dangerous, violent threats to community. And that public health problems like substance use and mental illness are addressed in the community, in treatment, early and as often as necessary to prevent further progress into the justice system. I think if we make treatment available to everyone who needs it and wants it, we will shrink the justice system. And it will be right-sized as opposed to taking up all of our state and federal budgets. The opportunities of the Affordable Care Act are phenomenal for this population. We've been doing a lot of work in that regard to help the justice system reframe its view of the amount of treatment that will be available for people. For years, we've been operating in an environment of scarcity, and we have built systems that sort of prioritize and triage based on a scarcity mentality. We now have the opportunity to access treatment virtually on demand for populations that are coming in contact with the justice system. And that's going to require the justice system to lose the scarcity mentality and realize the opportunity to access treatment on a broad scale for so very many people. And we've been successful in conveying that message in some environments. The treatment system is going to have to change its view as well about sort of how much treatment is actually going to be available for folks. And I think it's an incredible opportunity for communities to have have insurance coverage and then have the opportunity to do what so many others have done for years, and that is when their young people need treatment, when their young people are in trouble, they go to mental health counselors and they go to substance abuse treatment programs for care first, rather than calling the police or being involved in the justice system. So I think the Affordable Care Act is a great step in making treatment on demand available for everybody who needs it.
I think the Affordable Care Act is probably the most important public policy initiative to have come about with regard to addressing the issue of addiction in this country. everything that Pam said with regard to opening up the availability of treatment, where heretofore the individuals that have entered the criminal justice, the single males, primarily single women, had not had access to treatment because they did not have insurance and had to rely on federal limited block grant or state resources, now will have the ability to access treatment. That does everything that Pam said, but it also now brings addiction out of the stigmatizing arena into the public health arena in a way that has not been before. So the possibilities of integrating the criminal justice system client who is addicted and that client having access into the Affordable Care Act is absolutely a wonderful and I think really remarkable new policy, and potentially can change the way addiction is served in this country for the better.